Hi, I'm Chris Jensen. I'm a second-year resident in general surgery here at Duke University. So what I enjoy most about being a resident, I'm finally a doctor. This is something I've wanted to be for a long time since I was a kid, and now I'm finally, doing the things that I always envisioned. I'm in the operating room, I'm in the emergency room, taking care of sick people, having responsibilities that, are in some cases stressful, but in nearly every case really gratifying. That's definitely what I enjoy the most, is that just the actual mechanics of doing this job. And the other really important thing that I love is the people that I work with. They're all people that I really respect and look up to in a lot of ways that I learn from, right? I think people who choose to go into residency, especially surgical residency, are hardworking, passionate people who always are looking for ways to push themselves forward. And that's an energy that I really draw a lot of strength from. So the opportunity to spend, a decent chunk of every day with people that I joke with, that I laugh with, but that I also know I can count on and that I hope to learn from is really great. And I think that overall has made being a surgical resident really rewarding and a great experience for me. How has being a second-year resident been different from being an intern, right? Being a first-year resident. I would say the big thing is the responsibility, right? You're responsible for seeing consults, seeing new patients who may or may not need surgery. You're spending a lot of time in the ICU, taking care of the sickest patients in the hospital. You're often the first resident to see a new patient, and you're responsible for understanding as quickly as possible what the relevant factors are, and then communicating that to the right attending and the right team, and making sure that that patient gets the care that they need efficiently and correctly. So that is definitely the biggest change for me so far as a second year. I think beyond that, you get a bit more familiarity with the hospital and how things work. And so you're able to spend more time thinking about how to provide good care, and you're not just thinking like, where are the gloves and how do I get to this room, and like, how does my pager work? So you kind of don't have to spend as much time thinking about some of the basics, and you're able to spend a little bit more time thinking about the patients and the diseases and how to not just, what do I need to do, but how can I know what I need to do, how can I get this done as efficiently as possible in the best way? One of the greatest strengths of this program, probably the greatest strength, right, of the program, is its people. I would say I'm very close to, the people in my own class. I think we're all very close as a class, and they're people that I enjoy seeing every day. So I think, being in the trenches together in the hospital breeds a lot of solidarity. And the fact that we've all kind of had the same responsibilities and gone through the same challenges so far has really helped bring us together and made us really cohesive. And on top of that, we've all decided to go into this career together. So, I think we're like-minded people in a lot of ways, right? We all care very passionately about doing our jobs well and taking care of people who need it and doing that as well as we can. So, they're people that I enjoy not just seeing them at work, but also we hang out outside of work as much as we can. We have each other over to our houses, and we go out when we can to get drinks or get meals, and it's been really gratifying to have these people around as a resident, especially because this job is a demanding job. So having people who support you is really important, and I'm really grateful for that. When I chose Duke as a program I wanted to come to, it was because I thought that this place would make me into the best resident that I possibly could be, clinically in terms of my operating skills and decision making, and research-wise in terms of my abilities to do good research and contribute to surgical understanding. I think those things still hold very true, for me. Having been here for over a year now, I think those things are definitely true, and I will definitely have those opportunities like I thought. I think what's been added is that when I came here, I think I was very nervous. I didn't know anybody here. I wasn't sure, if people were going to like me, frankly. And I've realized that not only is that people are nice, but I really look up to and respect everyone that I work with here. I mean, the training here is really from top-notch people who care very much about my own development and my own success. And so it's been really nice transitioning from working with people who, frankly, intimidated me a little bit with all their accomplishment, to being people who I would consider, mentors and in some ways, in some cases like really friends, the people that I really enjoy seeing and working with and learning from as much as I can. So I think I still have, a lot to learn and a lot that I am a lot of things that I really respect about this place that has now been, I guess, augmented by, there's a sense of familiarity to being here. In a way, this place increasingly feels more like a home where I belong. So that's been really gratifying for me. I'm not originally from North Carolina. I've moved around a fair amount. I've lived up north, out west, and now I'm here. So moving here was definitely a change for me. I think finding a place to live, my first year I just sort of found an apartment that looked good and was close to the hospital, and that was it. And it's pretty easy. There's a lot of housing opportunities in Durham, and they're all pretty cheap and reasonably priced. This year I actually moved into a house with some co-residents, which has been awesome. Being able to choose who you get to live with and who you get to come home to has been a big improvement for me, because I enjoy seeing people outside of work. In terms of what to do for fun, I like to run a lot, so there's good parks and trails around Durham and in the Triangle that are great for getting out when you can and getting some exercise, just getting a chance to get away from it all. There's also, the beach is actually surprisingly close and very nice. Turns out very easy to get sunburned also, so I learned that the hard way. The mountains are about the same distance in the other direction, and so I've been lucky to see both of those and hope to go out there as much as I can in the next couple of years.